In other words, there are times when people get on an Advantage plan and they can never get off of those plans. Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making Medicare mistakes, and above all else, get the most out of your Medicare benefits. When people decide to go onto Medicare, they have two different ways in which their Medicare benefits can be used. One way is to use an Advantage plan. The other way is to use a supplemental plan. And during this brief video, I want to talk about Advantage plans and specifically about one aspect of the Advantage plan, and that has to do with what is called the 12-month trial period. Now, I'm going to explain that in detail here in just a couple minutes, but let's first talk about this question. Why do people choose Advantage plans? In other words, why would half of all people today choose Advantage versus supplemental plan? Well, number one, because Advantage plans are going to typically have a very low or no monthly premium. Now, when someone has an Advantage plan, they have to certainly pay their Part B premium. This year, that's $170.10 a month. Comes out of your Social Security check, or they bill you that quarterly. But we have to pay for our Medicare B. But many areas of the country have plans where there's plans that have no premium, or if it does have a premium, it's very, very low. In other words, it doesn't cost very much for you to be on that Advantage plan. In other words, that insurance company does not charge you a premium. And the reason for that is because you have co-pays instead of premiums. Okay, so they have very low premiums, but also people choose them because of all the perks that come along. In other words, these are these add-on benefits with Advantage plans that do not come with supplemental plans. And first off, those perks include a dental plan, typically about $1,000 worth of coverage for dental. Could be basic services and some other comprehensive services. You'll have vision benefits above and beyond original Medicare, typically one eye exam and a credit towards eyewear. And then most of the plans are going to give you some kind of hearing aid option. Now, you can't just get any hearing aid you want, but they have a series of hearing aids that they will cover, certain network providers that will cover those, and you'll have a very reasonable copay for some hearing aids. So that's a benefit. That's why people choose them. They also choose them because most of the plans today give you the over-the-counter benefit, which is basically a card allow you to go online or maybe into a catalog, and maybe $35 or $50 every quarter. You can go on and get things that you typically would pick up at a drugstore that would just be over-the-counter type items, maybe some supplements or Band-Aids or Tylenol or aspirin or those kinds of things. And that's a perk they offer. And then also gym membership. Most people have an Advantage plan that allows them to go to certain facilities and maybe a community center or Curves or maybe a YMCA or some place that takes the plan, and you can have a free membership to that particular gym. So those are perks available. And then lastly, some of the areas of the country have what's called a Part B reduction. Now, I will tell you that few people really qualify for Part B reductions because they're not either available or because your scenario would not allow you to do so. But when someone gets a Part B reduction, which is really best for veterans, retired military, retired federal government, and certain zip codes around the country, what they do is they give you a credit back towards your Part B premium. So right now, everyone's paying $170.10 a month for their Part B. So if that Advantage plan gives you a credit, they may credit your Social Security check at $30 or $50. And so instead of charging the full amount for your Part B premium, $170.10, it may be $120.10 or $150.10. So they give you a credit towards that Part B. That's called a Part B reduction. And again, not everyone can get that, but it is a perk that's available to some people in certain areas. All right, so that's why people choose them. Now, what people often, though, are not told are some of the potential problems. Doesn't make Advantage plans bad, but these are things that you have to know about that a lot of agents simply don't discuss. Number one, every Advantage plan is going to have a network of providers, doctors and hospitals, pharmacies that take the plan. Certainly not everyone is going to take every plan, but there will be a network of providers, whether it's an HMO or a PPO providers that allow you to go to their hospital, or certain doctors that will allow that. Now, there are some doctors that don't take any Advantage plan. Some take all, some take maybe the PPO, not the HMO. But again, it's a provider, a voluntary choice where they're going to participate in the network. And the reason we're saying that's a potential problem is because certainly not every doctor takes Advantage plans. So you have to make sure that the providers that you want to go to, the doctor, the hospital, different places where you get your care, that they're going to be in that network. So that can be a problem because because you're going to have limited choices of providers. Secondly, pre-certification. So when someone's on an Advantage plan, what happens if they need certain healthcare services, basically about 70% of all healthcare services, MRIs, CAT scans, skilled nursing stays, a hospital stay, outpatient surgery, those kinds of things are going to have to be pre-approved or pre-certified by the insurance company, which means that the doctor says you need a hip replacement. Well, the insurance company, the Advantage plan, has to approve that. Sometimes they do and sometimes they don't. Sometimes they may say therapy is enough for you, or we're going to pay for a rod only, not a full hip. But that you, given that insurance company through the Advantage plan, the right to have the final say-so. It's not your doctor, it's not you that make the final decisions. In comparison to that, when someone gets a supplemental plan, they don't have pre-certifications. Medicare and your doctor make all those final decisions. All right, so that is a potential problem because sometimes those services are denied or delayed. And then thirdly, and this has to do with the trial period, and I'll close with this, and that is the permanency. In other words, there are times when people get on an Advantage plan and they can never get off of those plans. All right, and so sometimes people would like to get off, but their health has changed, they've been on too long, and now they're going to have to medically qualify to do that. So that is an issue with Advantage plans. So let's talk about how this trial period works. That will be our third question. Who gets a trial period? Well, frankly, folks, in most states, and again, there are exceptions, but in most states around the country, your trial period begins when you enroll into Medicare A. And so you can see here, we have John Smith and Jane Smith. And John Smith decided to start Medicare at 65. And his Medicare card will look just like this. Hopefully you can see it, but it's saying that Part A and Part B both began January 1, 2022. And if that's the situation where both A and B match up and he went on an Advantage plan during that first year, he would have a trial period. And what that simply means is anytime, any reason during that 12-month trial period, if he wants to get off the Advantage plan and pick up a supplemental plan and a drug plan, he can do so. No underwriting is required. So in his scenario, he did have a trial period. He started Medicare at 65. He started with an Advantage plan. He would have 12 months to switch. And during that 12-month period, he would not have to go through underwriting to make that switch. But Jane, on the other hand, she decides to work longer, but she goes ahead and enrolls in Medicare A only for 1 year, and then she retires and picks up Medicare B a year later. In this scenario, in most states, Jane will not have a trial period because the trial period only lasts 12 months tied to the A date. And so her trial period already has terminated by the time she goes on Medicare. So day one on her Advantage plan, if that's what she chose, because she started 1/1/2023, day one, in order to get off of her Advantage plan and go to a supplemental plan, now she has to qualify. So he has a trial period, she does not. So it's based upon when you start your Medicare and what plan that you decide to start with. All right, so that's the trial period. So what happens after the trial period? So let's say that someone doesn't have one, or they did have one and didn't exercise the right to return to original Medicare, so they stayed on their Advantage plan 12 months and 1 day or longer, 3 years, 5 years, or 7 years, and now they would like to get off the plan. Well, the switching rules now apply. So you just can't do anything you want when you want to do it. Now you have to live with some rules. So what happens if someone's on an Advantage plan and they would like to switch to another Advantage plan? They can do that 2 different times of the year. So I can switch Advantage to Advantage October 15th to December 7th with the policy effective date of January 1 the next year. So October 15th, December 7th, my new policy goes effective January 1 on that Advantage plan. Or the first 3 months of the year, I can switch Advantage to Advantage. So if I make that decision in January, I can switch. My new policy goes effective February. If I switch in February, it'll go effective in March. I switch in March, it'll go effective April. Then after that, there's no other opportunity to switch Advantage to Advantage until the next year's Medicare open enrollment period. Again, there's no underwriting required. If that plan's in your area, you like it, you can have the plan. But what happens if the trial period is over, we're gone beyond the 12 months, or we didn't have a trial period at all, then if I want to get off my Advantage plan, now I want to move to a supplemental plan, now I'm going to have to medically qualify to make that switch. Many times people think they can just switch because Medicare has this open enrollment, and that is not true. Folks, if you don't have a trial period, either initially or ever, now you're going to have to medically qualify to get a supplemental plan. which means we're going to ask you 25 or 30 health questions. We're going to check all your medications, what you're taking now and what you've taken for the last 24 months. And then we're going to get a statement from your doctor, which means there could be some health conditions that would keep you from making this switch, because now that supplemental plan has every right, that company has every right to say, no, we're not going to approve your policy. And then you can stay on that Advantage plan then for the rest of your life. So to make the switch, you don't have to be ready to run a marathon, but you do have to be generally healthy. Things like rheumatoid arthritis, you'll not make the switch. If you have an AFib in your medical records, you're not going to get to switch. If you're under any kind of treatment right now, you're not going to get to make the switch. If you're taking certain medications, opioids, or certain things that are indicating a very serious health condition, you're not going to make the switch. If you're an insulin-dependent diabetic that has retinopathy or neuropathy, you're not, again, going to be able to make the switch. So there are certain health conditions that would keep you on that Advantage plan for the rest of your life. Now, it doesn't mean that you have bad insurance. It just simply means you still have to live with networks for the rest of your life, and you have to live with pre-certifications the rest of your life because you cannot medically qualify to pick up that supplemental plan. All right, so the 12-month trial period does exist, and not everyone gets it. It just depends on when they go on Medicare and what they start with. But those who do, if they don't take action within that 12-month trial period, then they are going to have to medically qualify to switch. Those that don't have a trial period, day one on the Advantage plan, if they ever want to get off of it, again, they're going to have to medically qualify to make the switch. And so hopefully their health will allow that. If it doesn't, then they will have to stay in the Advantage system. Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with the Medicare guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare guide. It would be our privilege to assist you further.